Hello everyone, Dr. Locklear here, and I'm coming to you today to talk about Module 8 and our concept of immunity. And our exemplar will be 8B, and we'll be talking about hypersensitivity. Now, this is something that we probably have all experienced somewhere in our life. We've already all maybe been stung by a bee or had allergies in the summertime, and here it is March, so we're getting ready to deal with the pollen. So if you are an allergy sufferer like myself, I am the allergy queen. It is just a constant battle. I can't go anywhere without a box of tissues. And I know you think, Lord, Dr. Locklear's got everything. He's got back problems, thyroid problems, sinus problems. Well, it's all true. But I'm not going down without a fight, okay? So we're going to talk about the patho, how does it work, and we're going to look at 4 different types of reactions. The causes, what's going on in our body versus the outside. What do we see when someone has a reaction? What are the diagnostic tests and who do we collaborate care with? Because we know that this can be a very debilitating and difficult disease, especially with children. And so we want to be very careful. And then, of course, we're going to look at our nursing process. So here's our overview. So hypersensitivity is an immune response to an antigen. So something triggers our body to respond to something it doesn't like. And so you have this substance, and it triggers our immune response, and that results in harm to the patient. So say I get stung by a bee and my body responds to that antigen or what was in the bee venom, and now my body's going to react to it, and I may have hives, itching, swelling, respiratory problems, and all these are very serious, life-threatening situations. So it results in harm to the patient. When the antigen is environmental or exogenous, the response is called an allergy. So you may have an allergy to pollen, to ragweed, to bee stings, peanut butter, different kinds of food. There's all kinds of food allergies. The antigen is referred to an allergen. So this allergen causes the reaction. I get stung by a bee or something. The tissue response is hypersensitivity, and so it may just be simple irritation like some itching, or you may have a runny nose and watery eyes, and that's my problem. I have what's called rhinitis. It doesn't take much to flare up my sinus allergies, and I just sneeze all the time. For me, it's as simple as opening a newspaper and smelling the ink. It'll just make me sneeze and sneeze. And so you may have a runny nose, watery eyes, itchy eyes. It may be like life-threatening because it can lead to blood cell hemolysis and laryngospasm. So it can really affect our red blood cell and cause our body to go in some type of shock. And the laryngospasms, our throat can swell up from the reaction to the antigen and cause us to have difficulty breathing. It's a very serious situation. Hypersensitivity are classified by the type of immune response that comes in contact with the allergen. So the reactions are immediate or delayed hypersensitivity reactions. Anaphylaxis, now this is life-threatening, and this is where you immediately start having breathing problems, you're swelling, you can't breathe, you go into like spasms in the throat, it swells up, the tissues close off your throat, and you have ineffective airway clearance. And of course, we want to give them some oxygen. That's one of the things that we do. The names of allergies sometimes refer to the organ system that affects them, like allergic rhinitis in the nose or hay fever. Some of the other things it talks about with immediate hypersensitivity is such as contact dermatitis. So maybe you brushed your hand up against some poison ivy and then you get a rash from it. Laundry detergents, soaps, lotions, things like that can flare up a skin reaction, and dermatitis is a skin reaction to an allergy. So our pathophysiology and etiology, so what's happening here and what is the cause. So with hypersensitivity, you have an antigen and antibody or antigen and lymphocyte interaction, and it causes a response that can damage our tissues. An antigen antibody response is characterized as type 1, 2, and 3. And you'll see this on page 511, types of hypersensitivity reactions. So type 1, you do need to know this. Type 1 is localized or systemic. So you may see hypotension, wheezing, GI or uterine spasms, stridor, difficulty breathing, and urticaria, which is a skin reaction. Asthma, allergic rhinitis, hay fever, and food allergies fall in type 1. Type 2 is tissue-specific reactions, and this is where the antibodies cause activation of the complement system that leads to the tissue damage, such as shortness of breath and a fever. You may see this with blood transfusions, and we know if the patient starts having a reaction, we stop the transfusion immediately and take it down. Put the head of the bed up, give them some oxygen, call the physician. You may see this with incompatibility to blood types and hemolytic disorders in the newborn, and we're going to talk a little bit about that. Type 3 is immune complex mediated reactions, and this is where there's deposits in the tissue, and the result is a generalized inflammatory reaction. Urticaria, skin, fever, and joint pain. And you might see this with acute glomerulonephritis, which is infection of the kidney and inflammation of the kidney, and serum sickness, and we're going to talk about that too. And then type 4 are delayed reactions. And so you may see this with a fever, erythema, redness to the skin, or itching. Contact dermatitis, a reaction to a TB skin test, or a graft host disease. So please make sure you review table 8-5 on page 511. So with type 1, you've got a very good detailed description here in your book. You have allergic asthma, allergic rhinitis, such as hay fever, allergic conjunctivitis, so you see inflammation in your eyes, hives on your skin, red, itchy, swollen areas, and anaphylactic shock, which is a life-threatening situation. All these fall under type 1, 2, 3, and 4, which is on your table. So with this type of hypersensitivity is triggered, an allergen interacts with free immunoglobulins, and so those help us fight. They bind to the mast cells in the basophils, so those help us fight inflammation as well. This antigen-antibody complex promotes release of histamine and other chemical mediators, and such as acetylcholine, kinins, and chemotactic factors. And so when these factors are released, such as histamine, you will have the swelling and the inflammation, and you'll see the reaction. That's why we have antihistamine drugs. When a potent allergen gets in the bloodstream, triggers a widespread antibody-antigen reaction, and then you have a response to chemical mediators. This is a systemic response, and this can be anaphylaxis, urticaria, or angioedema. And angioedema is like swelling in the face and around the eyes. Anaphylaxis, this is acute systemic type 1 response. It can lead to shock and death because you have breathing problems with anaphylaxis. You have extreme inflammation and swelling in the throat, and you cannot breathe. It occurs in highly sensitive individuals, people who are allergic to bee stings or peanut butter and things like that. You'll see these reactions very quickly. The reaction begins within minutes. So like if I'm reacting to blood products, I'm going to see the reaction very quickly. So you have a release of histamine and other mediators. It causes vasodilation, and as the vessels dilate, the blood engorges in the vessels, and of course it inflames the tissues. And so you may see smooth muscle contraction and bronchial constriction. So again, breathing problems. These chemical mediators cause the patient to experience manifestation of anaphylaxis, such as the breathing problems and the swelling. The patient notes a sense of uneasiness. They have a feeling of doom. They know something is happening to their body, and they will tell you, I don't feel right, something's wrong. They may have itching, lightheadedness in their scalp, and palms may feel itchy and burning. They may break out in hives. They have swelling in their tissues and around their eyes, lips, tongue. I've seen their tongue swell up. It's like that. Their tongue was so swollen they weren't able to talk. It was so big. You may see swelling in the hands, feet, and the genital areas. It can affect the uvula, which is that little thing in the back of our throat, the larynx in our throat. It impairs our breathing. And then we have bronchial constriction, which again impairs our breathing. The patient has air hunger. They're so swollen and the tissues are swollen, they can't get the air in, so they become hypoxic. They have stridor, so the air is trying to come through the swollen tissue. It's very high-pitched, and it's like a wheezing, high whistling, high sound. It sounds like air coming out of a balloon, if you've ever heard that. They have wheezing, they have a barking cough. These respiratory effects are lethal if the reaction is not reversed. You have to act immediately. We want to open the airway, give them some oxygen, call rapid response, put the head of the bed up, give them Benadryl or some type of drug to counteract epinephrine, and we'll talk about that. And yes, in emergency situations, you will have standing orders to help you go ahead and treat these patients without having to wait to call the physician. Vasodilation and fluid loss from the vascular system leads to impaired tissue perfusion. So now I'm even more air hungry, and hypotension. So my blood pressure is going to drop. And again, this is known as anaphylactic shock. And look at box 8-5. This is on page 513. And these are the substances known to trigger anaphylaxis. Insulin, isn't that something? Ragweed, eggs. A lot of people are allergic to eggs and peanuts and peanut butter. Chocolate. Look at the vitamins, thiamine, folic acid. We just talked about the alcoholic patient. Why, if they have allergies to these medications and they need these vitamins, they have to look at something else. Bee stings, and it lists several different types of insects there. Latex allergies, and as a healthcare worker, you will have to be tested if you have latex allergies. Antibiotics, penicillins, and sulfur drugs are usually the number one. So make sure that you read over that, okay? And that's on page 513. And so a localized response is more common with type 1. You may see like the contact dermatitis, rashes on the skin. Atopic reactions are the result of localized rather than systemic. So usually on the outside, not coming from inflammation on the inside. And so when you have allergen with the IgE in the bronchial tree, the nasal mucosa, and the conjunctival tissues, which is around the eyes, you will start to see symptoms such as asthma, allergic rhinitis or hay fever, conjunctivitis, and atopic dermatitis. Allergens commonly associated with atopic reactions of this type are pollens, and again, we're getting ready to get into that season, fungal spores, house dust mites. A lot of people are allergic to dust mites. Animal dander. A lot of people are allergic to dog and cat hair, so they can't have animals. Food allergies. And some of the responses you'll see with food is diarrhea, vomiting, severe abdominal pain. And so if the GI mucosa is altered by local allergic response, then the allergen may be absorbed and the resulting reaction may be systemic. So if it becomes systemic and not localized on the outside, hives and urticaria is the most common systemic response to food allergies. But don't let that fool you. With peanuts and especially in children, they do have the respiratory issues with that as well. And then you have type 2. So that was type 1. You have type 2, which is cytotoxic. And so this is a hemolytic transfusion reaction to blood of an incompatible type characteristic of type 2, or a hypersensitivity reaction to some of these blood and blood products. The IgE or IgM, which is these types of immunoglobulins, are antibodies. They're formed to cell-bound antigen, such as ABO and Rh antigen. The binding of these antibodies with the antigen activates the complement cascade, thereby resulting in the destruction of those cells. This type of reaction causes hemolytic disease in newborns. So with type 2, it may be stimulated by exogenous antigens, such as something foreign to the tissue or cells, or a drug reaction, so something from the outside, not with inside of your body. Which the drug forms an antigen complex on the surface of a blood cell, and it stimulates the production of these antibodies. So the body's going to fight when it comes in contact with something that is not compatible with the body's going to respond. But sometimes these responses are annoying, like having a runny nose all the time, but sometimes they're very dangerous and we need to act. The resulting antigen-antibody reaction destroys the affected cell. For example, the administration of certain drugs such as penicillins may cause a condition known as drug-induced hemolytic anemia. Withdrawal of the drug stops the reaction and the cell destruction. So if you know you're allergic to something, you don't need to take it anymore. I'm allergic to augmentin. I have a severe reaction. I swell, I break out in a rash, and I get really itchy. Sometimes you can react or not have no breathing problems. Sometimes it's just skin. The endogenous antigens, which are produced by the body, also stimulate type 2 reactions, resulting in autoimmune disorders such as Goodpasture syndrome, in which the antigens form to specific tissues in the lungs and the kidneys. So these reactions can affect multiple organs in your body. Hashimoto's thyroiditis, and that's the type of thyroid problem I have. I have Hashimoto's. And this is an autoimmune hemolytic anemia, and these cause it, like, shuts your thyroid down. And so I have lots of allergies because of that. But I said, I'm not going down without a fight, though. Type 3, this is immune complex mediated hypersensitivity, results from the formation of your IgG or your IgM antibodies. And these are in your circulatory system. When they're deposited in the vessels or in the vessel walls and the extravascular tissue, so this is outside of the cell, then the complement is activated and the chemical mediators of inflammation such as histamine, so you have that histamine release, okay? And so it attracts neutrophils, because we know neutrophils help as part of our immune system. And the neutrophils attempt to phagocytize the immune complex. So in other words, all these big words, the neutrophils are fighting. They're trying to reverse the reaction and reduce the tissue damage. Either systemic or local responses are seen with type 3, such as serum sickness. And this was named because it was first identified after administration of farm serum, such as horse serum. It's a systemic response. Immune complexes are deposited in the walls of the small blood vessels, the kidneys, and the joints. And so some of the manifestations of serum sickness include fever, urticaria, rash, arthralgias, this is joint pain, myalgias, that's muscle pain, and lymphadenopathy, which is swollen lymph nodes. Although foreign serums are no longer administered, serum sickness still occurs when you take drugs such as penicillin and sulfonamides. Like I said, penicillins and sulfur drugs. You still have that serum sickness type feeling. And that's the way it was with me when I had a reaction to augmentin. I had like serum sickness type symptoms. Localized responses occur at different sites as immune complexes accumulate in the glomeruli of the kidneys. You'll see maybe such type of infections as streptococcal infections in those areas, or glomerulonephritis, which is inflammation of the glomeruli. When antigens such as dust from mold or hay is inhaled, an acute alveolar inflammatory response can occur. And you see this with people that work outside a lot, out in fields and doing like industrial things outside. They're breathing in those dusts. So let's just stop here and recap a second. When we have hypersensitivity reactions, we can see it on the outside on our skin, or we can see it on the inside where we're having reactions from the inside that affect our breathing, and it affects our ability to, have open airways. And so outward reactions such as skin itching, swelling, hives, and then inward actions, inflammation in the lungs and your throat swelling, you can't breathe. Okay, so just wanted to recap that. But it's systemic, whether it's outside or inside, can be your whole body, and it's dangerous. Reactions are very, very dangerous. That was type 3. So type 4. Type 4 is delayed hypersensitivity. So type 4 differ from other hypersensitivities in 2 ways. They are cell-mediated immune responses, not antibody-mediated responses, and involve T cells of the immune system. Second, type 4 reactions are delayed rather than immediate, so they develop 24 to 48 hours after exposure. You often see this as a result from an exaggerated interaction between the antigen and the normal cell-mediated mechanisms. This exaggerated interaction results in the release of soluble inflammatory and immune mediators such as lysosomes or from the macrophages, and recruitment of the killer T cells, causing local tissue destruction. And so some of the type 4 is contact dermatitis, latex allergies, and you will see even with some of these, like a latex allergy can cause breathing problems. Make sure you read over contact dermatitis and latex allergies. You all should be very familiar with both of those. Please read that material, and that's on page 515, contact dermatitis and latex allergies. Latex is in a lot of things. Of course, rubber gloves, Band-Aids, they list several things here for you. Blood pressure cuffs, bulb syringes, Fleets enemas, IV bags. Just touching a bag of IV fluid sometimes can cause that. And so you'll have a natural rubber latex response, okay, and it talks about that, okay? So please read that, okay? And then the etiology, you have hypersensitivity classifications have different causing factors. Immediate or type 1 is facilitated by the immunoglobulins, the IgE, with the primary cellular component being the mast cell or the basophil. The reaction initially involves the production of the immunoglobulins in response to certain antigens, and it releases histamine. Okay, so like I said, if you have a runny nose, I might need an antihistamine to help dry up the secretions. Type 2 are primarily mediated by IgM or IgG G antibodies, and they bind to the cell surface of the antigens. Okay. On page 516, you have box 8-6, latex in the hospital and home environment. It lists the products in the hospital and the products in the community setting. I just want you to be aware. One of the things, earplugs, and a lot of people wear earplugs. And so some of the tubing that they use to do procedures with, we need to know if you have any kind of latex allergy, you may not be able to have that type. They may have to use a metal equipment. Also on page 516, box 8-7, measures to protect against latex allergies. You need to be checked for latex allergies if you work in a facility that has those, and wear non-latex gloves, and you may need to request those. When wearing latex gloves, do not use oil-based lotions on the hands because it can break down the latex. Some of the symptoms are rash, hives, nasal congestion. Contact your healthcare employer. Go to the wellness center or your HR department or your healthcare department. They usually have that. Okay. Make sure you read over that. All right. Some of the risk factors, look on page 516, and you'll see the risk factors listed under this little category here. Age, sex, illnesses such as asthma. So if you have asthma, you're more prone to have allergies and more reactions because it doesn't take much to trigger your asthma. Just smelling, strong chemical odors. You have to be very careful about the cleaning products that we use around children. Some of the other factors are older age, lung disease, antigens, route of entry, amount of antigen produced or introduced, how much are you exposed to, and the rate of absorption, and having a family member with allergies. My mother, she had bad sinuses just like I did. I'm sure I got it from her. And there's your list there on your slide too. And then at 4 types of reaction, type 1, 2, 3, and 4. Type 1 is localized, and you may see hypertension, wheezing, GI or uterine spasm, stridor, medical emergency, urticaria. Type 2, shortness of breath and fever. Type 3, urticaria, fever, and joint pain. And then type 4, fever, erythema, and itching. These are medical emergencies, and you need to respond to these. You need to react. Mild hypersensitivity responses is uncomfortable, itching, the swelling, just the sneezing, the runny nose. You may feel tired because you might not be able to sleep because you're just, you're coughing or you're sneezing a lot. May last hours to a few days. And over-the-counter medications like antihistamines can help. Rhinitis and asthma lasting beyond a day or two may result in a localized infection. So there may be an underlying infection going on if you've got some of these things that just won't clear up. And there's some more detail on page 517. So make sure that you read that. Moderate hypersensitivity, localized inflammation and pain, difficulty breathing. You may lose your sense of taste, smell, and appetite because a lot of times that drainage is running down your throat and it just makes you sick on your stomach. And some of the medicines that you have to take can make you nauseated as well. That helps counteract these reactions. The skin reactions are aggravating because they itch and they won't stop itching, and you just scratch, which then tears open the skin, and now your skin is susceptible to other infections because we all have staph on our skin. And then severe hypersensitivity reactions. These, again, are medical emergencies. The respiratory involvement is so in depth, and it can lead to death because if you're not breathing, we're not going to be able to survive. And so we want to focus our care on minimizing exposure, preventing the reaction if we can. Teach people don't let your kids eat anything with peanut butter in them. Keep an EpiPen if you know you're allergic to bee stings and different things. identifying the allergens, so having allergy testing, in your chapter talked about allergy testing, and then how do you react if you are exposed. Clinical manifestations, continued type of response, the onset, and what kind of manifestations do you see from it. Withdraw the allergen immediately. Get them away from it. If it's strong odors, get to an area where you can get some fresh air. Keep the airway open because it does affect perfusion, and when perfusion is affected, our oxygenation is affected. Airway, and it doesn't matter if the nursing diagnosis is impaired oxygenation or ineffective airway clearance. Something's blocking your airway. You need to give them some oxygen. Elevate the head of the bed, call rapid response. Any bleeding, renal failure, and supportive care, and we need to notify the physician immediately. Administer medicines that you have on hand. What is our collaboration? So we have diagnostic tests. We need to avoid certain herbal supplements. A lot of people are allergic to herbal supplements, so you need to have that conversation with your doctor or with the pharmacist before you start taking anything when you're on prescription medicines or you have allergies. Some of the lab tests, and this is listed on page 517. The CBC, this can detect high levels of circulating eosinophils. Should be 1 to 4%. It's often present in patients with type 1 hypersensitivities. The RAS test, this measures the amount of the immunoglobulin directed towards specific antigens. The results are compared with control values and used to identify hypersensitivities. RAS poses no risk for anaphylactic reactions. So what they do is they expose you to specific antigens and see if you're going to react to it. If you've ever had allergies, I've had allergy tested numerous times, and they did the little pricks on my back, and one time they did them on my arm just to see what I would react to. And so some of the things for me was black walnuts, certain types of grass, certain types of trees trigger my allergies. Blood type and cross match. We know we want to type and cross match to make sure that if a patient's getting blood, that they're not going to be allergic to it. And it lists here the different blood types. So they determine the patient's ABO blood group and the RH status. So are you RH positive or RH negative? If you're negative, you don't have the antibodies. And so they have to determine if you're positive. Look what it says. Individuals with this antigen are called RH positive. Those without are negative. Because a blood transfusion is actually a transplantation of living tissue, antigen matching is vital to prevent significant reactions. So you've got to give them the right blood. For example, I am O negative. I am what they call a universal blood donor. O blood matches any of the other bloods, AB, or whether you're positive or negative. So I'm negative, so I don't have the antibodies on there to trigger the antigens. So I can donate blood to, and they could use my blood for anybody. But when you become pregnant, if you're negative, then you have to get that shot RhoGAM, and you've probably already talked about that from OB. So when you have another pregnancy, you antibodies, if the child is positive, do not react with each other, and that RhoGAM prevents that. The indirect Coombs test, this is on page 518, and this test detects the presence of circulating antibodies other than the ABO against our red blood cells. The patient's serum is mixed with the donor's red blood cells. If the patient's serum contains antibodies to the antigen, agglutination or clumping together will occur. This is a positive response. The normal value is negative, so we don't want it to clump together. This test is also part of the cross-match of blood type and cross-match. The direct Coombs test, this detects antibodies on the patient's RBCs that damage and destroy the cells. This test is used following a suspected transfusion reaction to detect antibodies coating the transfused red blood cells. Okay, so they're looking to see if these antibodies are going to attack or not attack. On page 518, you have clinical manifestations of hypersensitivity. It talks about serum sickness. Hold on, I have to plug in my computer. Hold on. There we go. Thank you. It talks about serum sickness, allergic rhinitis, graft versus host. And you might see this if somebody's got a graft in. And then allergic asthma also. So page 518. Okay. Skin testing. Before I get to skin testing, let me go back. It won't let me go back. Well, also on page 518, you have immune complex assay test, and this is where they detect the presence of circulating immune complexes such as type 3. And then you have your complement assay test, and this is where they use the development antigen and antibodies, and so they're looking to see maybe what you are allergic to. Look on page 519 and you see a picture of someone who's getting the skin testing. And so they'll do the prick test, and this is where they put little drops, little pricks in you, and some of you probably had this done to see if you've got a response to specific things. Intradermal test, and this is where they will do a little bit of the allergen on the forearm, and they're looking, again to see what you may be allergic to also there. There's different types of tests. Just know the definition of those. And then food allergies, they expose you to certain food allergies, okay? All right. Then pharmacological therapies. So this is where we're talking about antihistamines. And so the antihistamines block the H1 histamine receptors, which lead to the reaction. And one of the best drugs is Benadryl. The only downside to Benadryl is it does make you sleepy. But Benadryl is very, very effective. It also dries out the mucous membranes, and a lot of these antihistamines dry you up, and so sometimes you'll have nasal bleeding because your tissues are so dry up in there because it dried up all the secretions. And we do have to have a certain amount of mucus to keep the membranes moist, because if they get too dry, they will have bleeding, which makes you more susceptible to infections. That certain amount of mucus keeps the bacteria out, and that's a good thing. It also talks about the different types of antihistamines, Benadryl, Zyrtec, Allegra, and these are just to name a few. There are many out on the market. Your mast cell stabilizers, they inhibit the release of histamine from the sensitized mast cells. And so this is nasal crom, some of the other ones, cromulin sodium, and you may see these as nasal sprays. Leukotriene modifiers, they're released by the blood in response to allergens, so they block the inflammatory reaction. And, again, the inflammation can cause you to have breathing problems. Corticosteroids, they also help with the inflammatory response as well. But this is short-term use. You don't want to be on steroids if you don't have to be, because of the long-term effects such as diabetes from it, and it affects your liver function as well. Immunotherapy, this is where they give you certain types of, maybe just to react the like long-term effects of steroids and things like that. And it's you'll see this, and I feel like I'm fumbling here. Also called hyposensitization or desensitization or allergy shots. I took allergy shots for 5 years and they really didn't help me, but they do help some people. And then epinephrine is for the immediate treatment for anaphylaxis, and it is given IV, or you can give it IM. It reacts very rapid, and your dosages are listed here for you. So for mild reactions with wheezing, pruritus, urticaria, and angioedema, you want to give it sub-Q 0.3 to 0.5 of a 1 to 1,000 epinephrine. If you have a bee sting, it's injected directly into the site of the sting, and you can also give it IV. But this is for a quick turnaround time. Epinephrine is a valuable drug, and in immediate, you got to turn them around really fast or they're going to die. And then Xolair is used for patients with steroid-dependent asthma, and so you may see this administered by sub-Q injection in the physician's office or in a clinic. Some patients may not experience improvement in symptoms for several months when they're on Xolair. And then it lists some new therapies for you that are still in trials, and I'm not familiar with the sublingual immunotherapy. It says it's been used for some time in Europe, but it's still under trials here. So just read over that. One that is on the market is Nucala, and that is one of the newer ones as well. Plasmapheresis, this is on page 521. This is where they go in and remove harmful components in the plasma. And so they go in and they try to get the antigen out that's causing the problem. And you'll see this with patients with glomerulonephritis and Goodpasture syndrome. It's really like a blood washing. They're trying to wash it out is what it is. Okay. Others, patients with allergic rhinitis or asthma, or they need to go to an allergist. You need to be seen on a regular basis, and sometimes they'll change your medicines around multiple times. And you need to talk to a dietitian if you're having food allergies. And then your complementary therapies. Patients with type 1 should consult their healthcare provider before using herbal remedies, because they contain substances that you can be allergic to, such as chamomile tea. Chamomile tea is used a lot to help you calm down and relax and help you sleep, but a lot of people are allergic to the components in it. And a lot of these herbal remedies do not go through the FDA. They go through their own, they're checked for safety, but a lot of them are not approved through FDA. Lifespan considerations, food allergies. All individuals with allergies to food and asthma may have an increased risk for the development of anaphylactic reactions. Teenagers with food allergies have the highest risk because they have a greater tendency to eat meals outside the home and less likely to carry their medications. Allergies tend to run in families, and so if you've got a family member, you may be very susceptible to that. Also in this little section, it talks about it's not uncommon for people to outgrow certain allergies, such as food allergies, like to eggs and milk and soy and wheat allergies. Some people are highly allergic to peanuts and tree nuts, fish and shellfish like shrimp and things like that. They should not be eating these things at all. Hypersensitivity in children, food allergies, 48%. That's half of our child population. Reduce the risk of exposure, educate families on what they shouldn't have. And school nurses have to be very mindful and have epinephrine and stuff like that on hand, and make sure these kids are checked thoroughly and that they have their EpiPens with them. And so some of these kids are highly allergic to some of these foods. On page 522, it gives you handling allergic responses in children, and it talks about if the tongue is poking or feels like something's poking my tongue, burning and itching, mouth and throat closing up, feel like you got a lump in your throat, or your ears feel like they're bugs or itching. These are signs that the child is having a reaction. Call 911 and request an ambulance. So if your kid's at school, this is what the school nurse should be doing. They should, try to you know, oxygenate them if they can, but you know, we don't have oxygen in the school systems. Do not attempt to take the child to the hospital. Call 911. More than likely, they're going to have to be intubated if it continues on. Again, your fish and shellfish, and then peanuts. And so these are some that we don't outgrow. Okay. And then it talks about the epicutaneous immunotherapy, or EPIC, could be the first FDA approved form of therapy for peanut allergy. So they are working on things to try to counteract these peanut allergies. And a lot of cookies and things like that have peanut allergies in them. What is our nursing process? We want to look and observe for presence of symptoms, skin rash, complaints of itching, signs of swelling, difficulty breathing. We want to look for the risk factors. You know, be careful with children outside, especially in the spring. I've already seen a bee flying around this morning. My mom always said, when you see the bees, it's time to go barefoot. Just a tidbit there for you. We want to observe for reactions and symptoms. The breathing, my throat feels like it's closing up. I can't breathe, you know, those type of things. And then we definitely want to talk about herbal supplements and medications. What we have to ask, what are you allergic to? The physical, we look at the mucous membranes. Is it dry, or is it a lot of drainage? Do you see lesions and rashes? Are your eyes red and irritated? A lot of watery drainage from the eyes? What's the respiratory rate? Are they having difficulty breathing? What are the breath sounds? Listen to their breath sounds. Are they absent, diminished? Nursing diagnoses, ineffective airway clearance. You know, you don't always have to have mucus to have ineffective airway clearance. You can have swelling and it's closed up. Decreased cardiac output, because we know if we're not breathing, that affects our perfusion. Risk for injury. These people can hurt themselves while they're having reactions. Impaired spontaneous ventilation. We're not able to get them intubated because their throat is so swollen. Some of these people in severe cases have to have a trach right on the spot. And those are listed for you. Goals, they will avoid known substances that provoke the reactions. Describe the self-care that they need to do, especially during seasonal allergies. Talk to your school nurse. Make sure they have, you know, and they're required to have this anyway, but the medications and stuff that you need to use, those types of things. Describe proper self-administration of your EpiPen and keep it with you at all times. Don't just keep it in your book bag, wearing your book bags in your locker, or keep it in your mom's car. It needs to be on you, on your body, and it needs to be within, not expired. We need to look at those expiration dates, but it needs to be on you at all times, not in another location. Identify food allergies. We want to educate on what the hypersensitivity reactions look like and how do we treat those. When and how to use the anaphylaxis kit. When to seek medical attention. In a child, don't wait, because they close up really fast. Okay, and skin care. How do we prevent the dermatitis? There's creams and stuff out there. One thing that I used to use, because when I first started having thyroid problems, I had dermatitis so bad, and I used something called Ultravate cream, and it really helped clear it up. It helped stop the reaction. For airway, highest priority and anaphylactic shock. Airway, airway, airway. High Fowlers, give them some oxygen if you can. Assess their respiratory status, level of consciousness. Keep talking to them. Look for nasal flaring, especially in the child, using those accessory muscles in their rib cage to breathe. Palpate for respiratory excursion. Are they retaining air down here? They can't get it out. Auscultate and listen for adventitious breath sounds, those abnormal breath sounds. Maintain patent airway, administer oxygen, insert a nasopharyngeal tube or oropharyngeal if you can. Administer subcutaneous epinephrine. Keep that EpiPen on them. Pop it in that leg and stay calm, because they're anxious. When you can't breathe, you experience a lot of anxiety. Monitor for cardiac output. Insert an IV and large bore. Get an 18 or 20 in if you can. Remember, they're having vasodilation, so you may be able to get them veins. Get a Foley in so we can monitor output. Place the tourniquet above the site of the injection. And once breathing is established, place them flat with their legs elevated so we can get some of that swelling down. Excuse me. Reduce the risk of injury during blood transfusions. Check for informed consent. Check the type and cross match. Make sure that has been done. You have to go through many checks and balances when you're giving blood, and it takes 2 registered nurses, 2 nurses, okay? Take and record vital signs within 15 minutes before giving it. You take vital signs right before you give it, and you take vital signs right after you give it. And if they have a reaction, you stop it. Use at least 20 or 18 gauge. Infuse the blood in a separate line. You may have to start a whole new IV. Administer Tylenol or acetaminophen and Benadryl before initiating the transfusion, and you'll have to have a doctor's order for that. Administer with normal saline and use a blood set tubing with the filter and the Y tubing. Administer 50 milliliters of blood during the first 15 minutes, and then you can increase it. During the transfusion, you want to monitor for complaints of back pain, chest pain, fever, chills, tachycardia, tachypnea, which is severe shortness of breath, wheezing, hypotension. So that's why when you take blood vital signs, you analyze your data. Okay? Stop the transfusion immediately. Send the blood back to the lab with the set attached, and notify the healthcare provider. Administer oxygen. Put the head of the bed up, and don't flush the remaining blood in the line. And then our evaluation, of course, they had decreased symptoms. They were able to use their EpiPen and demonstrate the use of it and talk about their disease process. And that's the end of this lecture for hypersensitivity.